Okay, so today we are going to be reviewing information from Cigna. They do a lot of member and employer surveys and also accumulate data throughout the year. And they have released their final findings for 2021. So I'm going to go over those today. There's some interesting information about mental health and what employers are looking to offer in 2022. So this presentation will be useful to you if you're in HR, if you're a CFO or CEO, if you're managing a business or workforce. And also, if you're an employee, it can be very useful or in some sort of management position because we go over some mindset that coworkers may be in currently, and there's some interesting statistics. So without further ado, let's go ahead and get into it. Okay, and before we get started, I always like to include a nice quote, a beautiful picture to relieve some of the stress that people build up around the topic of healthcare and health insurance. In life, change is inevitable. In business, change is vital, by Bennis. Just a reminder that we are constantly in flux and in a time where change is accelerating. And again, today I'm going to be reviewing information from Cigna and their final summaries of some of their surveys from 2021. Since 2021 has now closed, a lot of these insurance companies are releasing their data sets from 2021 throughout the first quarter of 2022. And just another nice positive visual reminder that we want to be outside of the school of fish and thinking differently, thinking outside of the box, accelerating forward quickly on our rocket ship. So 41% of US adults report anxiety and depression. I know that I have heard a lot about anxiety and depression and mental illness during the pandemic. I believe that this is an important note to make and to be reminded that our coworkers, our managers, our employers, everyone around us has had some sort of impact on their mental health this time, these last 2 years. And even if the person that you're dealing with doesn't have anxiety, the likelihood that someone in their household is dealing with depression and anxiety, therefore they have some sort of secondary experience, or there's some sort of secondary impact on the person that you're talking to, even if it's not a direct impact. Okay, over 100,000 drug overdoses occurred in a year period during the pandemic. This is from the CDC. And that doesn't include just all suicides. I'm not sure off the top of my head the rate of suicide, but I know that's up as well. Here's what executives report are benefits of a healthy workforce. So executives see a healthy workforce with greater retention. So 37% of executives report that the goal of getting to a healthier workforce is greater retention, and 45% saw greater productivity as a reason to drive towards a healthy workforce. And of course, health doesn't just have to do with the physical, it has to do with the mental and the social as well. And a lot of people throw in other parts of the wheel, like we've talked about in other presentations, such as financial and spiritual. 63% of today's work time workers have low to moderate resilience. So I dive into this a little bit more in future slides. I found this to be interesting because I wanted to see exactly what they are defining as resilience. It's a very subjective term, in my opinion. These surveys are quite subjective. Oftentimes these surveys, the way that they're worded, produce a certain outcome. So you have to be careful with how surveys are worded. I didn't get a chance to review the surveys, myself, so it's hard for me to say if that's the case here, but we need to proceed with caution and a critical mind when looking at this sort of information, because it is coming from a subjective source, which is a survey, and from people that wrote the survey questions. Doesn't mean we completely discard the data, in my opinion, but it's just something to keep in mind here. So Americans' resilience is at risk. Though resilience is inherent in every American, no matter their zip code or background, only 40% of adults surveyed are considered highly resilient, meaning 60% of the population is at risk of not being able to quickly recover from challenges and cope with adversity. Our current environment is testing resilience more than ever as the nation is witnessing the impact of a global pandemic, financial uncertainty, and increased awareness of systemic racism. At a time when many are facing unprecedented change and struggle, it is critical to understand how to build and maintain resilience, not only survive in uncertain times, but also to thrive in the future. Resilience, commonly defined as the ability to quickly recover from challenges, is closely connected to people and communities that surround you, from family, school environments to the workplace. Under the Cigna Resilience Index, Cigna set out to better understand these conditions and relationships, as well as the nuances of resilience, by conducting 2 national surveys among school communities and the workforce. So I thought this was an important note to include so that you understand where this information is coming from and how they are defining resilience. Oftentimes we pass by these terms, no, this many people are resilient, and we assume the meaning and the definition of that term. So I want to make sure that we're not assuming what Cigna means by resilience. Okay. Resilience among US children and youth. So this is showing 42% of parents are considered resilient. So they're defining resilient as this 40%, which is highly resilient. So these are the categories of highly resilient. So to be resilient, you have to fall into the category of not moderately resilient or low resiliency, but you have to have high resilience. So 42% of parents are highly resilient. 45% of children under the age of 10 are resilient. Children 11 to 13, 34%. 14 to 17 is 35%, and young adults 18 to 23 are 22% resilient. And then if you look at the workforce, you see full-time workers at 37% resiliency, and it slowly goes down to 28%, 27, 26, 25, and then finally at 18% for laid off workers. So it goes from full-time, part-time, furloughed with benefits, furloughed overall, and then furloughed without benefits. Okay. To understand the state of resilience, so again, this is from Cigna, their Resiliency Index survey. To understand the state of resilience in the US, Cigna conducted 2 national representative surveys among children 5 to 17 years of age and their parents, young adults 18 to 23, and US workers, including full, part-time, furloughed workers, and laid off workers. The research was conducted in partnership with Dr. Michael Ungar and the Resilience Research Center at Dalhousie University. And it is based on the Child and Youth Resilience Measure and Adult Resilience Measure, 2 17-item questionnaires developed by RRC, which is the Resilient Research Center, the CYRM, which is the Child Youth Resilience Measure, and the ARM, which is the Adult Resilience Measure, are self-reported measures of resilience. And all findings are based on this self-reported data. To calculate resilience among adults, critical cutoff values provided by the RRC were used to differentiate low and moderate resilience and moderate and high resilience. To calculate resilience among children using modified versions of the resilience scale, cutoff values that correspond to the normalized Z-score of adults, cutoff scores were used to ensure comparability and resilience levels across differently scored instruments. So that's a little bit of geek speak for you to talk about how they came to these three different categories. So they have low, moderate, and high resilience. And basically it's all, again, survey data. So individuals with high resilience show robust constellation of personal qualities that let them flexibly take on stress situations as they arise. They also have in place social and institutional supports they need to deal with bad times, or the ability to find new resources when the situation demands a different set of supports. So the way I take this is someone that may be able to start a different career, if maybe their career is no longer of as much value in the world, maybe they have the opportunity to move to a different industry where that is thriving during a market change. Moderate resilience, individuals who are moderately resilient have some of the skills they need to cope, but occasionally doubt their ability to overcome challenges as challenges increase in intensity. The source of support they enjoy are available, but tend to be inconsistent or fragile. People who with moderate resiliency can cope well under some circumstances, but become stressed as situations change. They need new personal skills and social supports. Individuals with low resilience have trouble staying focused on their strengths and generally lack the support they need to cope with unexpected stress. People with low resilience not only perceive few opportunities and are less optimistic about the future, but they also don't enjoy the psychological, social, economic, and institutional resources that make people successful or make success possible, excuse me. So I found that to be quite interesting because I think of the correlation that this may have to a time where people are looking at a recession and how consumers may be feeling about the environment and all of those reports that come out in financials and how that correlates to this information that we're seeing here. Here's how companies are preparing to support the behavioral health of their workforce. 47% provide manager training and recognizing mental and behavioral health issues and directing employees to those services. So employers are becoming more and more aware of employee programs that they can add, such as counseling, phone counseling, EAP programs that make that free to the employees so that they can reach out and can get the support that they may need. Sometimes employers have these programs built into their health insurance and they don't even know it. So as a result, the employees don't know that they have those plans. So it's very important to educate your employees about the programs that are available so that they can use them as needed. Here's how companies are preparing to support behavioral health. 92% of employers expanded support for mental health and emotional well-being in 2021. Again, expanding the program is great, but making sure that you're communicating that program to the employees and making it easy for them to access is something that is also extremely important. 50% intend to initiate campaigns to reduce the stigma around mental health issues. Employers and employees are feeling the crunch. So this is shifting gears, talking about prescription drugs. And I have seen this skyrocketing since I've been in the health insurance business. I've been doing this for about 18 years now, and I was told that at one point when you're designing a plan, you would calculate about 20%. When I started, it was about 20% of the cost of the total premium would likely go to prescriptions. And as I moved through my career, we had to keep reevaluating those numbers. And at some point, it got to about 50% for certain demographics and certain age groups, and sometimes even higher. Because these specialty medications have grown so much. And you'll see that here represented. That's my anecdotal testimony of what I've seen. But this is more collective data of what Cigna is seeing. And they're saying the net cost of drugs has risen 3x faster than inflation. Of employers, 67% of employers cited the effect of new $1 million treatments as their top pharmacy benefits management concern. So there are certainly medications out there that are hundreds, tens of thousands, hundreds of thousands, and they're saying this top concern millions of dollars. New medications are breaking out, and the technology is absolutely wonderful that they're able to resolve some of these chronic conditions. However, the cost of those conditions to change someone's life or even save someone's life can be completely astronomical, which is devastating, just absolutely devastating. Roughly 25% of Americans find it difficult to afford prescriptions due to out-of-pocket costs. So a lot of insurance plans have several categories of prescriptions. They have their generic, their brand name, and their non-formulary. A lot of times there's a cap on that copay, but sometimes, especially for specialty medications, sometimes there is no cap. On some of these higher deductible plans, there's no cap. So now the employee is faced with a deductible, a large deductible. Maybe they moved from a plan that did have a set copay, and now they moved to a less expensive plan. And they didn't realize that their insurance is applying that cost of that prescription to their deductible. And they didn't realize that their prescription cost $1,800 a month because they were used to paying a $50 or $75 copay. This happens. A lot of times people don't know exactly how much their prescriptions cost until they go off a plan or onto a high deductible plan. Here is why specialty drugs present a challenge. Specialty drugs are used to treat complex and rare chronic conditions such as cancer, hemophilia, hepatitis C. If all pharmacy, 66% of all pharmacy costs are attributed to specialty medications, pharmacy is the #1 driver of healthcare costs. Right. I kind of touched on that already. 73% of the drugs that were in the pipeline in 2021 were specialty drugs, including gene therapies. So one of the reasons this happens is because this is where a pharmaceutical company can get the money back that they've invested into that new medication. The more complex and rare a disease is, the less customers you have. So if you're treating something like diabetes or high blood pressure, you have more people to charge for that medication. So maybe at first, it's a specialty and it's not patented, or it is patented, but you don't have anybody that can come in and create a generic drug after that first 7 years you can, but during that first 7-year period, you cannot have a generic of any medication. They're protected. They can really charge whatever they want. as a pharmaceutical company. So the rarer and the more complex the diseases, the less customers that pharmaceutical company will have. And so therefore, the more they have to charge each customer for that pill or that injection or that treatment. Recently approved gene therapies can cost more than $1 million for a single treatment. So I believe there was a Netflix special on this. I wish I could recall the name, but there was one in particular that they highlighted. I believe it was a neurological brain condition that a child needed to extend their life. I mean, if they didn't have this medication that cost $1 million a year, this child would die within a 5-year period. Whereas if the child had this treatment, they may have the ability to reverse some of the neurological damage that was being caused by their condition and therefore extend and improve their life. Okay. 6 in 10 Americans are living with one or more chronic diseases, 60%. These conditions require proactive management, sustainable engagement, and the right care plan based on the patient's unique needs. So a lot of times when we're going into looking at medical plans for our clients, we're looking at how this is going to impact people that do have specialty medications, that are taking medications every month. And sometimes employers and decision makers that have never dealt with a chronic condition before, they're mostly looking at, oh, what happens if we have an emergency room visit? Yes, that's very important. Oh, what happens if we are, they need to go to the doctor? What are the copays? What's the deductible? Those are all wonderful questions and super important. But one item that we really always have to point to and really look at are the prescriptions, because like this is showing, 6 out of 10, you don't always know who in your group. It could be a spouse, it could be a child, might not be the employee directly, it might be one of their family members, is using a prescription that they absolutely have to have every single month. And if the cost of that goes up substantially, it's going to impact your employees' productivity. If they're worried about how they're going to pay for their medication and they're stressing out about that every day, they're not going to be very productive. Or if they're not able to get it or afford it, they're not going to be very productive. Since the beginning of the pandemic, digital health solutions have moved from support role to center stage. There are more than 300,000 digital health applications on the market, with approximately 200 more being added each day. So again, this is a little bit of a topic shift. We looked at mental health, and then of course prescriptions, and now more of the data sets that Cigna collected this year, it was in regards to online services for health. So I know the rest of the world already knows this, but insurance is the very last one to do anything with technology. They're the last ones to implement systems. It's usually everybody else, and then the banks, right? And then the banks finally got online banking. It was like a new thing 5 years ago or something, not very long ago. And meanwhile, everybody else had an app for everything, and the banks were still, using paper, everything. And then the insurance companies are always last. It's a big deal to have an electronic ID card, and still not every insurance company has that. I mean, most of them do now, but even just a few short years ago, you have the top ones maybe had the access to a digital ID card, and it was really hard to get to, and it was a pain, but now it's a little bit more streamlined. But my point is, the healthcare industry and the insurance is always last with all these technological changes. So be patient with them. It's like, oh, wow, digital health is a thing. Like, haven't we known this for 20 years? Yes, but it's taken us this long to get to this point. So it's happening slowly but surely. And these online systems, these online enrollment systems are finally working out some of the kinks, and same with claim systems and things like that. So, all right. So what do employees think of virtual care? 69% want the option to choose a virtual visit over an office visit, even after the pandemic ends. Yes. Who used virtual care during the pandemics? 80% report patient satisfaction with that care that they receive virtually. What do employers think? 80% believe that virtual care will significantly impact how care is delivered in the future. 21% of larger firms and 15% of smaller firms added a new digital program or digital content for well-being initiatives. All right, so if you want a copy of any of this information that I've provided today, and you want to reach out to me, I have a link down below that you can reach out to me through. You can also email me here. And I hope you enjoyed the information. If you find any of this useful, please comment, like, subscribe, share the video, and we will talk soon. All right, thanks for hanging out with me.